Hello, Dr. Sandra Miller, audiologist and co-owner of Complete Hearing in Lincoln, Nebraska. We want to talk about the importance of hearing well, and you can only hear well with hearing devices if they're inserted correctly. So if you are working alone in terms of with yourself, do I have my hearing aid incorrectly, or you are a caregiver, you are a husband, wife, daughter, son, you're on the front lines currently working with the residents in some type of assisted living center or facility, we want to help you. So one thing, if you're noticing that the person you're with is not hearing well, is we want to make sure the devices are in correctly. The first one I'm going to show you is actually something called a RIC. The most important thing with this device, I'm going to put it in and show you that when you put this in, you really shouldn't be able to see it. And so there's a little stem that goes over the top of the ear with the hearing aid hanging behind the ear, and the speaker goes into the ear. There's this little stem, right? And what it does, it helps everything stay in. So make sure that when you see the hearing aid on the person's ear, that it's nice and flush and flat against the ear. If this hearing aid is hanging out of the ear, the patient is not getting the benefit of the speaker being down inside the ear. The other hearing aid we want to show you today is going to be something that's more like a full shell or in the ear. Make sure that the piece that goes down inside their canal goes deep inside the ear, and then the portion actually is just shaped like their ear. So when you put this in, this part goes in first, and then what you want to do is just kind of turn it this direction and make sure that all the pieces are tucked into the ear and it's flush with the ear. This is how this should look. Again, if this is not down inside the ear correctly, the patient is not going to be getting the benefit of hearing well. The last one I want to show you today is more of a canal style, similar to what I just showed you. This is the outside, this is the inside. The inside is always going to look kind of like at the canal portion of the ear. The outside is always going to be where the battery is. So make sure that when you put those inside the ear that the canal portion goes in, and there's usually a hole at the bottom we call a vent. Make sure that's typically at the bottom of the hearing aid. And again, just pushing down straight in the ear. And when you look at the ear, it should always be flush to the ear. So these are just some helpful tips for you to make sure that when you are wearing a hearing aid, that if people aren't hearing quite well, we want to make sure, number one, it's in correctly. And check out our other video that talks about how do I even know if it's working. If you've learned something today and you enjoyed the tools we're providing, go ahead and like and subscribe. Thanks so much.